the advantages of mandating a major in health systems transformation for all pre-medical students far outweighs the disadvantages. I'm Dr. Chad Swanson. I'm on a journey to understand and transform our health system. I'm a full-time emergency physician. I recently posted a video recommending and advocating for a required major for all pre-medical students and a required minor for all other health professionals in health systems transformation. This is a major that I don't even think exists yet, but I think every pre-professional health professional should major in it. I received some feedback, which I really appreciate. One piece of feedback was that the classes that I suggested really are already found in public health. And my response is, first of all, thanks for that feedback, because the classes that I suggested aren't all the classes that I would include, and we'd have to think that through carefully. But as someone who's received a master's in public health from Johns Hopkins, and I've also taught in a university public health students as an adjunct faculty in a public health department, this is something I put a fair amount of thought into. So public health certainly has a strong foundation in wellness, in prevention, in behavior change. There is a strong sense of working on different levels, so the micro level, the local level, the meso or organizational level, and the macro level in society and nations. There has, especially over the last 20 or 30 years, had a large emphasis on equity and the social determinants of health. Where I think this major could be different and more appropriate for health systems transformation. Number one, I think there needs to be a strong foundation of complex adaptive systems theory. So I think that could potentially include a significant amount of the idea of emergence and innovation. And I realize that there's plenty of that in public health, but I think it needs to be foundational. I do get the sense, and I'd appreciate full-time public health faculty and practitioners' feedback on this, but I do get the sense that public health is still dominated by projects. So there's grants that are received, and then disease-specific projects that are delivered. And I don't fault public health at all for that. I think as a nation, and as a society, and as a culture, we appreciate and value public health. And so public health has kind of been forced to adapt to focus on projects, but that's another focus that I think that a health systems transformation focus would not be so project-based. And then finally, there would be a significant emphasis on trans-professional collaboration, the need for leadership that breaks down barriers and collaboration. Again, there's plenty of that in public health. I don't want to come across as critical necessarily, but I do think that a major that would focus on social change, urgent social change, and describing the need for it could be very valuable. Another question or criticism that I received is that the last thing we would want is for all physicians to be one-dimensional. So currently, a pre-medical student can major in whatever they want. I majored in philosophy. I have friends that majored in music and in microbiology and architecture. I mean, you can major in whatever you'd want. And this commenter suggested that the profession would become too one-dimensional. That may be true to some degree, but in my mind, the advantages far outweigh the disadvantages. So I think we would enter this major, or pre-medical students would enter the major with their own perspectives and experiences, and so they would come to this major with that, so that would add some diversity. There would also be electives within the major. Somebody could double major, so you could double major in philosophy and health systems transformation. And then finally, there would be differing interpretations of the subject matter itself. So people would come in with different political persuasions and experiences. And so I think that the advantages far outweigh the disadvantages. And the advantages are that I think that a systems perspective changes, for me at least, it's been paradigm shifting. So it's kind of changed everything, the way I view health, the way I view our health system. And so currently medical school is focused largely on the physician-patient interaction at one specific given point in time and focused on treatment. as it should. Now, we could certainly argue for the need for health or for medical school reform, and we should, and I'm certainly in favor of that. But this would be systems transformation from a social change perspective, which would consider economics and history. And so another criticism was that there's already a shortage of physicians, and that creating a major like this would exacerbate that problem. I disagree completely. I think that there are plenty of pre-medical students that would be very interested in the idea of being a health systems transformation leader. There is, as I understand it, a surplus of pre-medical students interested in going to medical school. The problem isn't that we don't have enough interest from pre-medical students. The problem is that we don't have enough spaces in medical school. Now, I take a different view of the need for physicians, and I did a separate video for that, and I will provide a link for that video as well. Another criticism is that the pre-medical students that go through this major after they've already gone all through medical school, and I think this commenter called it all fluff, they just won't understand or won't know how to apply this knowledge. I think that's a potential risk, though if it's set up in the right way, I think there could be certainly value that these ideas would be reinforced during medical school, reinforced during residency, and then reinforced during practice. And I think that could be a large benefit. This commenter suggested that these ideas of health systems transformation should be taught in medical school. I disagree entirely. I think these ideas should be reinforced, but there's just not enough time in medical school. There needs to be a focus on the clinical specialties and basic sciences, et cetera, as it's currently set up, with some significant reformations and changes. And then finally, there was this idea that if someone doesn't get into medical school, it'd be wasted time. I disagree with that 100%. Someone who, first of all, I envision a major that isn't only for pre-medical students. It's a health systems transformation medical major, so anyone could take it. Someone interested in going into law or policy, or education, or media, or a different health profession like nursing. And so if someone either chooses not to go to medical school or plans to go to medical school but doesn't get in, the major, the knowledge and the perspective would still be highly valuable for any number of perspectives. And then people all the time major in something and then go into a different field. So I think for me, it's helpful to think of the late 1800s when Black people were not considered competent to be physicians, when women were not considered strong enough and have the mental fortitude to be physicians, and hospitals were thought to be places where people just went to die, and germ theory was novel and needed to be challenged and reinforced, and the idea that disease is spread through miasma or these kind of noxious air. The acceptance of nursing, the acceptance of medical specialties. There was a time when medical specialties were shunned, or people that wanted to, or physicians that wanted to specialize in surgery or whatever would be shunned by their medical societies. And there was a time when physicians weren't paid that much. So my point is there have been tremendous changes in our organization, our structure, our system, in the assumptions, in the way that we view ourselves as healthcare providers. And we need a similar change today. We need a transformation on a historical level. So I'm not even sold on this idea of a mandatory pre-medical major in health systems transformation. I'm more just sold on the idea that we need a health systems transformation with the primary driver being health and well-being for all at the lowest possible cost to the system, as opposed to rescue episodic treatment and profits and elitism or prestige. So I'd love your comments and ongoing discussion. Thank you.